I'm going to invite Matt up now. Have a seat, Matt. You sit over there. I'll sit over here. Where we go. You can get closer. It's all right. So Matt and I actually worked previously on a study we did for the meat industry, 2017-18.
Yeah.
So Matt's very smart. That's why I have him here today. A little bit of feedback. Matt's very smart. He is a statistician. Mm-hmm. What else do you do, Matt?
Spent a lot of time on the phone to you.
That's true.
And a lot of work on this psychosocial measure that we're trying to get up and running. So.
With what we did previously, so when we looked at the meat industry, what were the factors you were looking at there?
So we were looking at injury claims and better understanding the data, and I guess one of the pressures on people within a company is to get people back to work to fulfill the work tasks that you have in mind for them. And so when someone is injured, there is a push or a pressure to want to get them back to work as quickly as possible. And what we found that some of the biggest claims in terms of injury and time off from work comes from people rushing back too early to work. And so I guess one of the core messages that we had for organisations was it's actually in your best interest to ensure that people stay away from work when they need that time to recover and don't come back too quickly, or it's going to hurt them and it's going to hurt you as well in terms of your productivity and the staff that you have.
Or alternative, Matt, if they do return, don't return them to their pre-injury duties so fast that they're aggravating it, work them up in a slower manner.
Absolutely. Yeah.
So I reached out to you 6-7 months ago now to talk about an idea. Mm-hmm. And one of the things that we'd sort of started to look at from the psychosocial hazard perspective is the assessment was limited. When you did your research, when we looked at those 14 factors, because a number of those I hadn't really considered as psychosocial hazards until I read through the Safe Work document. What did the research find?
Well, there's a common saying among researchers that all models are wrong, but some of them are useful. And it certainly applies here with those 14 factors in that there is just this wealth of studies that exist. There's over 70 or 80 reviews that have been done over several thousand studies looking at workplace conditions and the outcomes both in terms of stress and psychological outcomes as well as physical outcomes including injury and time off and sickness leave and things like that. Those 14 factors that we've been talking about this morning are very well supported across a range of different work environments, a range of different job types. There's a robustness to those findings that these things are predictive. As Carly said, they're sort of lead indicators of things that are going to go wrong in the future in terms of the injuries, the psychological issues as well. But the thing that struck me most, I guess, in looking at that literature is not just the robustness of those things, but actually the modest or moderate predictive value of those things, which tells us as researchers that either we're not looking at all the variables that are really important, and Carly touched on that before, perhaps we're not looking at these variables in the best way, or there's some sort of complex pattern to the relationships among these variables that may enhance our ability to predict who's at risk or which work environments are riskier than others.
And were there any of those factors that had, I guess, less valuable research done on them at the moment?
I guess the limiting factor, or two limiting factors I would mention, firstly is that those models are quite general and aren't necessarily always drilled down to very specific job types or very specific industries. So it's a model that gets stretched across so many different employees, so many different job types, and seems to work reasonably well. The other thing though is that often in the literature we'll look at one variable at a time and how well it predicts these outcomes. Or maybe we put a couple of them together, but only in a very simplistic way. So if we look at the presence or absence of trauma in the workplace, job demands, the leadership quality, those things together do a better job of predicting outcomes than each of these individually. But it's rarely the case that the researchers will look at trade-offs between them. If you have a good leadership model or structure, but it's also demanding work, is the leadership structure going to offset the demands of the work and are people going to be happy? Or do you actually need positives across all of those areas? And the general assumption in reading the literature and some of the existing measures as well is that more of these hazards equals greater likelihood of bad outcomes, which makes sense, and the evidence definitely supports that. But as Carly was saying before, it's that middle ground is the really tricky part. It's what if you have a couple of these hazards? Is that bad? How many of these hazards? Which combinations of these hazards do we need in order to say something's wrong here and needs to be improved? And that's a big grey area, and that's what we're working on together at the moment.
So you talked about measures. One of the things that we've seen thrown out a lot over the last 10, 15 years are the psychosocial survey. My issue with that has always been if I've had a good day, I'll answer it one way. If I've had a bad day, I'll answer it another way. So does it give me a picture of what's going on in the organisation, or does it give me a snapshot of how people felt that day? What other limitations did you find when you were doing the research around psychosocial surveys?
Well, I think it's important to say up front, and we're not trying to be snake oil salesmen, but you do a survey, it's not going to tell you that this employee has this level of risk and on Tuesday they're definitely going to call in sick. Think of it as a starting point for a conversation. I think that's come through in the presentations earlier, how important it is to have this conversation with leadership, have good leadership thinking about the work environment, what's working well, what's working poorly. And so we're trying to set up a measure that generally finds where things might be working well and where things can be improved. But one of the things that seem to be somewhat lacking is the level of nuance here, where in some job contexts there may be a trade-off, as we said before, that some things can be bad, but as long as other characteristics are really strong in the workplace, you'll probably have thriving and well-supported employees who are going to stay, who are going to stick it out and won't have the psychological and physical consequences that we're concerned about. But one of the things missing from a lot of the measures is a potential disparity in views between the employer in how things are going in the environment and the employees as well. So one of the characteristics we're trying to bring into the measure that we're looking at is looking at what the employee says the environment's like and what the employees say and what the leaders say. And if there's a discrepancy there, it's a basis for a conversation about what might be improved or why there might be those discrepancies, what they're telling us.
And were you able to find a survey that actually looked at all 14 aspects that Safe Work Australia have raised?
I would say yes in the aggregate. There are some that cover them all. Most zero in on some rather than all. But across all the measures, and there are about 40 or 50 measures that we're able to identify, the key thing again comes down to the trade-off and using more sophisticated analytic approaches to say, yes, you've got this particular risk factor in this particular environment, and yes, we think it's something you need to action because of all these other things that we see in your data, or in this instance for this organisation, yes, there are some concerns about job strain, but people are well compensated for it. They come into the role with very clear expectations of what the work is like, and they identify and want to do that sort of work. So it's like the AMBO experience, that you know it's going to be a traumatic and tiring experience, but if you have good leadership around you and good support, then perhaps that's offsetting all of those concerns in that work environment. And so that trade-off isn't necessarily coming through in the measures that exist.
So with the research that you've looked at, you and your team have looked at, what are the areas that's been quite robust, where you can sit here and go, pretty much we know that we hit this level, we know it's a hazard, as opposed to those ones where it's a bit more ambiguous and it's harder to set a limit. Okay, now we know this is a hazard.
It depends how you quantify what's consistent, because I'd say all 14 of the factors that we've been discussing have robust evidence to support them. It's just that there's that nuance that some things may be relevant for some job types or some industries, and that level of data is somewhat lacking.
Okay. Yeah. Turnover. What's turnover tell us about an organisation?
Well, it's probably a good indicator, but as Carly was saying, probably a lagging indicator of potential problems in the work environment.
So if an organisation was to go and look at their turnover and the turnover was considered high, that'd probably be a good place to go, well, we've got a problem. If their turnover's low, it's not saying they don't have a problem, but there's possibly things that have been managed a bit better.
Absolutely. Absolutely. So I think definitely if you're seeing psychological harms, physical harms, issues of turnover and sickness and time off, or presenteeism versus absenteeism, they're indicators that something's problematic, but the absence of those doesn't necessarily give you a pass that everything's fine. You do need to look at the environment as well, because there could be things manifesting that you would see if you came back a year later. There are these problems that could have been diagnosed from a snapshot of the environment.
Yeah. So, absenteeism, it's easy to look at, annual leave, sick leave, those sorts of things, a very good indicator. But what about where there is an abundance of annual leave? People have got 8-10 weeks annual leave. That's got to give us an indication of something as well.
Yeah, and it could be a variety of things though. So I don't think we can point to one specific study or one specific solution and say, well, if there's so much banked leave, that's always a problem. It could be an indication that there aren't deputies in roles so people don't feel like they can go on leave. But that may not be the case for all environments. So I'd be hesitant to say there's just one answer for that.
So the tool you're helping us develop, artificial intelligence background, how's that going to help?
Yeah. So artificial intelligence is useful for big data problems. So we can do a basic survey, get a bunch of data from employees, and we can look at how things interact, and that will deal with the trade-off idea that we've been discussing. But we could bring in other sources of data as well. And as you start to add in more and more data, it becomes much harder for any of us to, as humans, to look at the pattern of results and very clearly see what the problem is. Whereas a machine can very easily churn through and look at the data and come up with patterns for us. Patterns that we might often miss ourselves because they are complex. We're talking about interactions between 10 or 20 different variables, which is a very hard thing to do. The downside or the potential problem with an artificial intelligence solution, and one that we're aware of in creating this measure, is that it's only as good as the data we feed into it. So you may have heard of a lot of weariness about artificial intelligence models in the bias that they can introduce. So there are examples where people have created models for recruitment, and the people that get recruited, or that the model suggests to recruit, are really just perpetuating things that exist in the workplace already. So if there are gender biases in recruitment, there are gender biases in the algorithm that's created as well. So there needs to be some human oversight to understand where there might be blind spots, but the advantage, coming back to your question, is it can take a large amount of data and analyse it and find patterns, or suggest patterns rather, that we probably wouldn't be able to see as humans or as researchers. So we're hoping to find insights that perhaps haven't been discovered to this point in understanding the work environment, and both a good environment and a poor environment.
Because I guess the man hours to wade through that much data would almost make it a financial impost on a business to go to the detail.
Absolutely.
And how does, you and I have talked about different iterations. With the right algorithms, so Carly talked about EAP data, exit interviews, those sort of things. With the right algorithms, the tool can mine through that information and look for trends?
Absolutely. But it's agnostic in the sense that it doesn't matter what the data is. Just if there are patterns to be found, it will find it more effectively and quicker and more cheaply than humans will.
And you talked about the bias of that can be built into an AI tool. I guess the other side is, though, if you've got it set up right, what we're taking out of it is the bias of the person doing the assessment.
Yes. Yep.
Excellent. Thanks, Matt. Anything else you want to add?
No.
No, there we go. Excellent. All right, can we grab Carly and Jay and Alex, and we're going to do our panel.